Every 34 seconds, someone suffers a heart attack. Think about that for a moment. Right now, as you're watching this video, somewhere in America, another person is having a heart attack. By the time you reach the end of the next minute, nearly 2 more people will have experienced one. Every year, over 800,000 Americans suffer heart attacks, making heart disease the leading cause of death for both men and women. What shocks cardiologists most isn't how often heart attacks happen. It's how often the warning signs were there beforehand. Not dramatic warnings, not the kind of symptoms Hollywood likes to show. No one suddenly grabbed their chest and collapsed to the floor. Instead, they felt a little more tired than usual, a little more out of breath, a little less like themselves. Small changes, easy to ignore, easy to explain away. And that's exactly why heart disease remains the leading cause of death among adults over 50. The danger isn't always what you feel. The danger is what you dismiss. Maybe you've noticed your energy isn't what it used to be. Maybe climbing stairs feels different. Maybe you've had episodes that seem strange but disappeared before you had time to worry about them. If that sounds familiar, I want you to stay with me today, because this video could change the way you look at your body forever. My name is Dr. Kang. For more than 20 years, I've worked with adults over 50 and studied how aging affects the heart, blood vessels, circulation, and long-term cardiovascular health. And over those years, I've noticed something remarkable. Many people assume heart attacks happen suddenly. In reality, the body often starts sending messages long before the major event occurs. The problem is that most people don't recognize those messages for what they are. That's exactly what we're going to fix today. By the end of this video, you'll understand the 5 warning signs cardiologists never ignore. Why these symptoms often appear weeks or even months before a heart attack. Which warning sign is responsible for countless missed opportunities to prevent serious cardiac events? The hidden risk factors that quietly damage arteries for years. And the simple questions you should ask your doctor if any of these symptoms sound familiar. Most importantly, you'll understand why so many people miss these warning signs even when they're happening right in front of them. Stay with me until the end, because warning sign number 1 surprises almost everyone. In fact, most people don't even realize it's connected to the heart. And that's exactly why it gets ignored. Before we begin, let me know where you're watching from. I genuinely enjoy seeing comments from people all over the world. And if you're serious about staying healthy, independent, and active after 50, every week I share evidence-based information designed specifically for adults who want to protect their health as they age. Now let's begin with something many people misunderstand. A heart attack doesn't begin in the heart. It begins in the arteries. That's where the story actually starts. Years before a heart attack happens, tiny injuries begin forming inside blood vessels. At first, there's no pain, no obvious symptom, nothing that would make you schedule a doctor's appointment. Meanwhile, cholesterol particles, inflammatory cells, calcium deposits, and other substances slowly accumulate inside the artery walls. The process is gradual, so gradual that most people have no idea it's happening. Imagine a highway with 4 open lanes. Traffic moves smoothly. Now imagine construction gradually closes one lane, then another. Traffic still moves. Nobody notices a problem. Then another lane closes. Cars begin slowing down. Eventually, only one narrow lane remains open. Now, all it takes is a single accident to create complete gridlock. That's very similar to what happens inside an artery. For years, blood continues flowing despite increasing narrowing. Then one day, a clot forms, blood flow suddenly stops, and part of the heart muscle is deprived of oxygen. That is a heart attack. The reason I'm explaining this is because the symptoms we're about to discuss are often signs that blood flow is already becoming compromised. The heart is trying to tell you something. Most people just don't know how to listen. Which brings us to warning sign number 5. Unexpected shortness of breath. Many people assume heart problems always begin with chest pain, Sometimes they do, but sometimes the first symptom is simply finding yourself unusually winded. You walk up a flight of stairs you've climbed hundreds of times before. Suddenly, you're breathing harder. You need a moment to recover. You tell yourself you're getting older. Maybe you're out of shape. Maybe you didn't sleep well. But here's what cardiologists know. When the heart isn't receiving enough oxygen-rich blood, its pumping efficiency can begin to decline. The body notices. One of the first ways it responds is by making breathing feel more difficult. That's why unexplained shortness of breath should never be automatically blamed on age, especially if it represents a change from your normal baseline. And that's an important word: change. Cardiologists care less about what you can do today and more about how that compares to 6 months ago. That's often where the clues hide. And what I'm about to tell you next is even more surprising. Warning sign number 4 is unusual fatigue. And before you skip past this one because it sounds too simple, I want you to pay close attention. This symptom may be responsible for more missed warning signs than almost anything else on this list. Why? Because fatigue feels normal, especially after 50, especially after 60, especially if you're still working, helping family members, caring for grandchildren, or dealing with the daily stresses of life. Most people don't wake up one morning and suddenly think, this might be my heart. They think, I'm getting older. I probably didn't sleep well. I've been busy lately. I just need a vacation. And sometimes they're right. But sometimes they're not. The fatigue that concerns cardiologists isn't ordinary tiredness after a long day. It's a different kind of exhaustion. A heaviness, a lack of energy that doesn't seem to have an obvious cause. Activities that used to feel easy suddenly require more effort. A short walk feels longer. Household chores feel more demanding. Even getting through the afternoon feels harder than it used to. The reason this matters is because the heart is the body's engine. Every muscle, every organ, every cell depends on blood flow. When circulation becomes less efficient, energy production throughout the body begins to suffer. Your body may be receiving just enough blood flow to survive comfortably while resting, but not enough to perform efficiently during daily activities. And that's when fatigue begins appearing. What makes this symptom so dangerous is that it can develop gradually, month by month, year by year. You adapt without realizing it. You lower your expectations. You stop doing certain activities. You tell yourself it's just part of aging. Meanwhile, the underlying problem continues progressing. I'd spoken with countless patients who looked back after a cardiac event and realized they had been feeling unusually tired for months. At the time, it seemed insignificant. Looking back, it was one of the earliest clues. Now let's move to warning sign number 3. Discomfort in the jaw, neck, shoulders, or upper back. This one catches people completely off guard. Most people associate heart attacks with chest pain. That's what we've all seen in movies. But the nervous system doesn't always work that neatly. The heart shares nerve pathways with several other parts of the body. As a result, discomfort originating from the heart can sometimes be felt elsewhere. Some people notice aching in the jaw. Others experience pressure in the neck. Others describe a strange discomfort between the shoulder blades. Some even feel symptoms in the left arm. The key detail is that these sensations often appear during activity and improve with rest. Maybe you're carrying groceries, walking uphill, working in the yard. Then the discomfort appears. You stop, rest for a few minutes, and it fades away. That's not a symptom you want to ignore. Your body may be giving you valuable information about how your circulation responds under stress. Again, this doesn't automatically mean a heart attack is coming, but it absolutely means the symptom deserves attention, especially if it's new, especially if it's becoming more frequent, and especially if it's happening alongside other symptoms on today's list. Which brings us to warning sign number 2, chest pressure. Not necessarily pain, pressure. This distinction matters. Many people expect severe pain, a crushing sensation, an unbearable emergency. Sometimes that happens, but not always. Many cardiac patients describe something much less dramatic: a tightness, a heaviness, a squeezing sensation, a feeling that something simply doesn't feel right. Some compare it to having a heavy object resting on their chest. Others describe it as pressure that comes and goes. The important thing to understand is that the heart muscle itself doesn't complain very loudly in the early stages. Often the signals begin subtly. That's why recurring chest pressure should never be ignored, particularly if it appears during physical activity or emotional stress. Those situations increase the heart's demand for oxygen. If blood supply cannot keep up with demand, symptoms may begin appearing. And now we've reached warning sign number 1, the warning sign that surprises almost everyone: reduced physical capacity. In simple terms, you can't do what you used to do. Not because you're injured, not because you've stopped exercising, not because you suddenly become unhealthy. You simply notice that your body isn't responding the same way. The walk that felt easy 6 months ago now feels harder. The stairs seem steeper. Recovery takes longer. Your endurance isn't what it was. Many people assume this is inevitable aging. Sometimes it is, but sometimes it isn't. One of the most important questions in cardiology is this: what has changed? Not what can you do today. What changed? When did it change? How quickly did it change? A noticeable decline in exercise tolerance can be one of the earliest indicators that the cardiovascular system deserves closer evaluation. Because healthy blood vessels are what allow the body to perform. When blood flow becomes restricted, performance often declines before major symptoms appear. This is why athletes monitor performance so carefully, and it's why older adults should pay attention to changes in physical capacity. Your body often notices problems before medical tests do. Now let's talk about the factors that silently increase risk: high blood pressure, elevated blood sugar, smoking, chronic inflammation, physical inactivity, poor sleep, excess abdominal weight. These factors don't usually create immediate symptoms. Instead, they work quietly, year after year, damaging blood vessels, reducing flexibility, increasing plaque formation, and creating conditions where a serious cardiac event becomes more likely. The dangerous part is that people often feel perfectly fine while this process is occurring. That's why prevention matters so much. It's easier to protect healthy arteries than to repair damaged ones. And that's exactly why awareness is so powerful. Because awareness leads to action. Action leads to prevention. And prevention changes outcomes. So here's what I want you to do after this video. Take a moment and honestly assess your last 6 months. Have you experienced unusual fatigue? Have you become more short of breath? Have you noticed unexplained discomfort in your jaw, neck, shoulders, back, or chest? Has your physical capacity changed? Are there activities you quietly stopped doing because they suddenly felt harder? If the answer is yes, don't panic, but don't ignore it either. Start a conversation. Talk with your healthcare provider. Write down your symptoms. Pay attention to patterns. And most importantly, listen to your body, because the body is often far more honest than we realize. If today's video helped you, subscribe and turn on notifications. Next week, I'm going to reveal the blood test many adults over 50 never ask for, even though it may provide valuable information about cardiovascular risk years before symptoms appear. You won't want to miss it. Leave a comment below and tell me which of these warning signs surprised you the most. I read as many comments as possible, and I genuinely enjoy hearing your experiences. Take care of yourselves, stay active, stay informed, and I'll see you in the next video.